pharmacy today at the National Institute of Health to talk about my administration's work to crack down on price gouging, to lower prescription drug costs, to put money back in the pockets of hardworking families, and to reduce government spending on prescription drugs at the same time. Usually when you talk about government doing something that's going to affect spending, I think it's going to be, we're going to help people and going to cost taxpayers more. But this lowers taxes as well as lowers costs for individuals. Too many folks lay awake at night, and I know from experience watching, that staring at the ceiling worrying what will happen if their spouse gets cancer, or if their child gets sick, or something happens to one of them. Do they have enough insurance? Can they afford the medical bills? Will they have to sell the house? Will they? I get up and, you know, it's easy to understand it. And we all know somebody who's been through that experience. This isn't just about health care. It's about your dignity. It's about security. You know, I think some of the press was with me when I was in Northern Virginia, and that a very distinguished-looking woman stood up, and she looked like she was in her early 40s, maybe a little older, and she said she had a problem. And the problem was she couldn't afford the insulin for her children who had diabetes. She had 2 of them. Talk about having to cut it in half. So because the cost was as much as $800 a month for them. And her insurance couldn't cover it. Think of all the people in this country that are going through something like that. It's about giving folks just a little more breathing room. That's what this is about. For too long, Americans have paid more for prescription drugs than any advanced nation on earth. You can have the exact same drug made by the exact same company in the United States, and you buy it in America for one price. You go to Toronto, Paris, Berlin, or any other major capital in the world. In fact, you'll find they're paying 2 to 3 times less than the American is paying at an American drugstore. Folks, it's wrong. Results, seniors are skipping doses, cutting pills in half, foregoing prescriptions entirely because they simply can't afford the prescription drugs. But not anymore. We finally, after all these years, beat Big Pharma when I signed the Inflation Reduction Act to get seniors and taxpayers a better deal. For years, there's been no check on how high or how fast Big Pharma can raise drug prices. In the year before we passed this legislation, drug makers jacked up prices nearly 4 times faster than inflation went up. And they were already too high. Let's call this for what it is. It's a rip-off. They're ripping off Medicare. They're ripping off the American people. And but we're now fighting back. As part of our law, which passed last year, drug companies can raise prices more than, if they raise prices more than inflation, they'll have to pay back the difference between inflation, has it gone up, and the price they charge. And that means consumers will pay less as well. They're going to save taxpayers money and discourage companies from raising prices in the first place. Here's how it's going to work. And on its face, it seems complicated, but it's really not that complicated. Every quarter, Medicare publishes a list of drugs administered by doctors whose prices have been hiked too much too fast. Today, Medicare is announcing its latest list. 48 prescription drug prices were raised faster than the rate of inflation was raised in the same period. These drugs are used by 750,000 Americans. If medication you take is on the list, our program is going to keep your costs down. For example, many seniors taking the drug Signifor, for growth hormone disorders, will save over $300 per month. In the last year, 64 different drugs have been listed for these rebates. Some seniors have saved more than $600 per dose.